when I move into the laser on the foot, I'm going to show you with the massage ball head. I'm going to apply a touch to the foot. If your client is sensitive or ticklish, then you just take it off the foot and go above there. And also the sensitivity level on the bottom of the foot in regards to how painful it is. So we'll deliver the laser therapy first, all to the bottom of the foot, right around to the heel and the fascia, and concentrating right on here in the medial part, which is usually the most tender. Okay? And notice what I'm doing here is I'm actually moving the foot around, okay, controlling what the foot does, and I'll have the patient flex and extend the toes, so the toes will come back and they'll go down. So I want to get some movement in that fascia, and then they'll relax. I'll apply a good amount of pressure, and because the fascia on the bottom of the foot runs up the entire back of the body and actually ends above the orbit of your eye, I'm going to work and laser into the calf, the soleus, the gastroc, posterior tibialis, and all the flexor tendons of the foot. So then I'll come up into this region. This one I'm going to apply more pressure, and I'm going to do the same thing. I'm going to lift up, I'm going to support and hold, and then notice I can do two at once. Come in and really control the tissue depth that I'm going. And when you're working in close to the shin, okay, I'm going to take the ball, move right along that area, and I'm going to use my other hand as a guide point for going along that region, and I can get a reaction from the patient on what they're feeling and the amount of tissue that I'm pushing in. And if you get right to an area where you feel that adhesion or that knot, then I'm going to focus and I'm going to rub a little harder and then move on. Okay? You'll notice that this area is extremely tender with how the fascia attaches to the bone. So that's where the laser comes into play, to reach that deep, deep fascia that attaches to the bone that you can't reach superficially. The final part that we want to tape with plantar fasciitis is the thoracolumbar fascia. And yes, that's far away from where the foot is, but it's a crucial player in the mechanics of gait and foot strike. So if I can improve that cross-body mechanism of gait, walking, and running, it'll relieve the pressure on the bottom of the foot. So make sure you do your thoracolumbar fascia with every case of plantar fasciitis.